development of hepatitis, and you have hepatitis, what you can do to prevent the development of advanced liver disease that could put your life at risk. I want to start with very basic concepts. So, for instance, where the liver is located. You see, human body is on the right side, right below the costal rib. Generally, you don't feel the liver, the organ, unless it's enlarged. Generally, you don't feel it when you touch your belly. Sometimes when it grows, in patients with cirrhosis or other liver diseases, you can feel it right below the costal rib. So why the liver is important, though? What are the functions of the liver? So there are many very important functions that the liver provides to the human body. You cannot live without liver, and it's key to remove waste and harmful chemicals. It's very important to combat infection and filter toxins from the gut. If you think about it, all the things that you eat, all the toxins, the first place that they go when it's absorbed in the blood is to the liver. The liver filters all those toxins and takes the blood to the heart, and from the heart it goes to the rest of the body. So it's a very important filter to remove all the toxins and potential infection that comes through what we eat. It produces a fluid that's called the bile that helps with digestion of fats. It's also very important to store sugar, vitamins, and hormones. It's a factory that produces a lot of fundamental proteins that are key to combat infections, to help with the clotting system. And it also converts stored sugar to energy. It's a very effective machine to produce energy in a short period of time. So that's why it's very important to keep the liver safe. When we talk about hepatitis, it's a very broad concept, and it essentially means inflammation of the liver. And there can be different causes for that. There can be different reasons why somebody could have an inflammation of the liver. Now, the problem with inflammation in the liver is that over time, that inflammation can cause what we call fibrosis. Fibrosis is when the liver becomes scar, it develops a scar, it becomes stiff. And when you have a lot of fibrosis, when you have a lot of scarring, is what we call cirrhosis. The problem with cirrhosis is that the architecture of the liver is distorted, is abnormal, and that's when the liver stops working properly, stop doing what it's supposed to be doing. All the things that we mentioned a couple of slides ago, the liver will stop doing that, and that is life-threatening. So since we cannot live without liver, when the liver stops working, you can have significant complications related to that. There's a final stage that we know that patients, when they have a lot of scarring and they have cirrhosis, they are at increased risk of developing liver cancer. So that's why we need to cut this natural history of the disease from the beginning. We need to prevent the development of hepatitis that will prevent the development of scarring, cirrhosis, and ultimately cancer. You have a picture that is very illustrative of what I mean by having a healthy liver here in the left and a liver with cirrhosis here in the right. So in the left, the liver is smooth, the surface is linear. You can see that it looks fantastic, right? As opposed to the one in the right, in the bottom right, where you see the liver with cirrhosis, nodular, not looking very good, right? So that's when you have cirrhosis in the right side, is when you can eventually develop complications. The liver stops working, and that's when patients start to be considered for a liver transplant, because the liver just cannot do what it's supposed to be doing, and we need to replace it for a new liver that can recover the function and do what it's supposed to be doing. Now, when we talk about liver disease, there are many different causes for liver disease. There are many different reasons for which somebody would develop a liver disease. Almost everybody knows that alcohol abuse can cause liver disease and cirrhosis. Now, the problem is that people think that that's the only cause, and people don't like to talk about liver disease because they think that alcohol is the only reason to have a liver problem. Well, there are many other. infections, and we'll talk about that. We'll talk about hepatitis B and hepatitis C, the main causes of liver disease by far in the world, much more than alcohol. Being overweight, and specifically what is called fatty liver, non-alcoholic fatty liver disease, or fatty liver in short, is an increasing cause of liver disease, an increasing cause of cirrhosis in patients that never drank a drop of alcohol in their life, but they have risk factors for developing fatty liver. And that's very important to know, because if you know that you're in risk, you can do something to get tested and prevent the development of the disease overall. And there are other causes much more rare, like immune activation of the immune system, we call autoimmune hepatitis or autoimmune liver disease. Very rare, it can happen, but they're not the most common causes of liver disease. Let's talk about the three main causes. The first one is fatty liver or non-alcoholic fatty liver disease. It's essentially the most common liver disease by far, and it's caused by the abnormal storage of fat in the liver. So when you become overweight, you can store fat in the skin, but you can also store fat in the liver. The majority of patients will have no problem with that. There are estimated 18 million Americans that have fatty liver, and there's no problem with that. Now, a very small percentage of those patients will develop inflammation, again, hepatitis, will develop inflammation because of the fat, and that inflammation can cause scarring, cirrhosis, and ultimately cancer. So that's why we need to identify those patients. Again, the percentage is very small, but there's so many patients with fatty liver that it's very important we identify these patients as soon as possible. So what are the risk factors for developing fatty liver? Here I have a list of the most important. You have obesity, you have high cholesterol. The most important by far is you have diabetes. Diabetes is a well-known and a very strong risk factor for developing fatty liver. If I had high blood pressure, generally in patients with older age, if you have family history of liver disease, if your parents, if your mother or your dad, they have liver disease, they have cirrhosis because of fatty liver, that puts you at risk of developing fatty liver in the future. In some ethnic groups, for instance, Hispanics, we are at high risk of developing liver disease related to fatty liver, and that's very important to know also. So the second main cause of liver disease are infections due to hepatitis virus. And this can come in two main types. One is what you call acute infection, acute hepatitis. That's mainly caused by the virus A, B, or C. So any of these can cause an acute infection of the liver. However, there's another type of hepatitis related to virus that is called chronic hepatitis. And that's only caused by hepatitis virus B or C. Hepatitis A cannot cause chronic disease. With hepatitis A, you have acute infection, either you die or you recover completely. Majority of times you will recover. Only very few patients could die due to hepatitis A. And with hepatitis B or C, you can develop chronic infection. What that means is that for reasons that we don't fully understand, the body is not able to eliminate the virus after the infection. So there is a continuous interplay, let's say a continuous war between the virus and the body. The body is trying to eliminate the virus, but it's unable to do that. So that the result of that is that there is continuous inflammation of the liver, there is continuous damage of the liver, and that, as we spoke in the past, will cause scarring, will cause fibrosis, will cause cirrhosis, and ultimately cancer. So how are these viral hepatitis transmitted? How the virus is spread? Let's talk about hepatitis B first. They share some of the main risk factors, but they're not exactly the same. The most common way that hepatitis B virus is transmitted by far is during childbirth. The mother is infected, and at delivery, it can infect the newborn during delivery. So that's by far in the world the most common way the hepatitis B is transmitted. Second one is unprotected sex. Third is sharing needles and the use of illicit drugs. There are many patients that get infected because of these. Other items contaminated with blood products, shedding some razors that can have blood with somebody that is infected. In dialysis, this is relatively rare. It's more uncommon now because there are many ways that this are tested, so it's very rare that you get infected. But you could get infected, decades ago when we were not so aware of the existence of these viruses. Hepatitis is relatively similar, the way it can be infected. Sharing needles is the number one cause of infection due to hepatitis C. Blood transfusion before the blood was tested for hepatitis C. So before 1989, we didn't know about hepatitis C. So the people that got a transfusion before that could have been contaminated with hepatitis C because the blood was not tested at that time. If you think about it, we're talking about 30, 40 years ago, but it's true. So the time that the virus takes for the patient to develop cirrhosis can be decades. So even you get infected, and this is relatively typical, a patient that got a car accident in 1965, got a blood transfusion at that time, the patient has been fine since then, and now comes to the clinic because he or she has cirrhosis with liver cancer, right? And they never knew about that because they had no symptoms related to that. Again, dialysis is rare because, the dialysis units are very aware of this and there are measures to prevent this from happening. Unprotected sex, you can get infected with hepatitis C with hepatitis sex, but it's less common than hepatitis B. Hepatitis B is more efficient as an infective virus. It's easy to get hepatitis B than hepatitis C through sex. And mother to child at birth, again, it can happen with hepatitis C, but the risk is much lower than with hepatitis B. I think one of the most important messages that I would like to deliver today is that at least half of the patients that have viral hepatitis were infected at birth. And this happens mostly in certain areas of Africa and Asia, particularly in sub-Saharan Africa. A lot of patients were infected at birth, and that poses significant challenges in terms of managing. Look at the map of hepatitis B worldwide. You can see, there's a lot of blue, is that there is a lot of hepatitis B. And the highest incident areas are Africa, sub-Saharan Africa, and Asia. China, 8% of the population in China, 8% they have infection of hepatitis B. Over 1 in 10 African-born persons that we test are infected with hepatitis B. So just to show you that, not many people are aware of this condition, but it's very common. And that's the reason you need to be tested at least once in your lifetime. Now, what are the symptoms of liver disease? And here I group everything. I group viral hepatitis due to hepatitis B, hepatitis C, or fatty liver disease, because the symptoms are very similar and the symptoms are generally none. You don't feel anything. Unfortunately, the liver does not give symptoms until the disease is very advanced. That's why it's so important to be proactive and check your liver at least once in your lifetime to make sure that you don't have hepatitis B, hepatitis C, or potentially fatty liver. Some patients may have some abdominal pain, some tenderness in the belly. They may feel fatigue, some nausea, weight loss, not much appetite. These are kind of vague symptoms, nothing very specific. But again, most of the patients don't complain of anything. You may develop jaundice. So jaundice is when your skin becomes yellow. You have here a couple of examples. The right hand is yellow, it's clearly yellow. It's very obvious, you don't miss it. And it's very obvious when it happens in your eyes. So the white part of your eye becomes very yellow. It's very easy to detect. And that suggests that you may have a liver disease. You need to be checked immediately. The other thing is the urine becomes very dark, as you can see here, even darker than that. It can be like Coke, very, very dark. So who should be tested for hepatitis B and hepatitis C? And these are recommendations from the CDC. Everybody, anyone that is older than 18 years old, any adult essentially need to be tested or should be tested for hepatitis B or C at least once in their lifetime. What about fatty liver? Well, if you have diabetes or obesity, also you should be tested for the potential development of fatty liver. And how's the testing done? Well, for hepatitis B, hepatitis C, and fatty liver is very easy, it's very simple. It's just a blood test. As easy as that. With the results of the blood test, we can know if you have an active infection. So if your hepatitis B, hepatitis C is active, so you have viral replication, you need to be treated. We can know if you had the exposure to hepatitis B or C in the past and you develop protection against that. Or for the case of hepatitis B, if you had not had the infection in the past and you're not protected against hepatitis B, you can get vaccinated against hepatitis B. So every newborn here in the US is offered, or the parents are offered the newborn to be vaccinated against hepatitis B, a very safe and a very effective way to prevent hepatitis B infection. Just to give you some numbers of the impact of that. So in Taiwan, there's a lot of hepatitis B. And since there's a lot of hepatitis B, there's a lot of chronic liver disease, there's a lot of cirrhosis, and there's a lot of liver cancer related to hepatitis B. So in the mid-80s, the government started a nationwide vaccination program for all newborn babies in Taiwan that would get vaccinated against hepatitis B. So 20 years later, the decrease in liver cancer is dramatic. A disease that was relatively common now is you barely see liver cancer related to hepatitis B in the new generations. Just to give an idea of how safe, effective, and what a fantastic intervention is vaccination against hepatitis B. If you're infected, you have active infection against hepatitis B or C, you need to check with your hepatologist because these conditions generally need to be treated or at least followed. And yes, hepatitis B and C are treatable. So check with your PCP, your liver specialist. There are medications very effective to control hepatitis B infection. You cannot cure hepatitis B, but there are ways you can decrease the replication to a point where the disease would not be a problem. And since very recently, approximately 8 years ago, 7-8 years ago, we do have drugs that can cure hepatitis C. So a treatment of 3 months or 2 months, depending on the medication, can cure hepatitis C in more than 95% of the patients. If you get treated, so if you have hepatitis B or C and you get treated, that prevents you from developing the complications of the liver disease. So you will not develop cirrhosis and you will not develop, or you will decrease the risk of developing liver cancer. So that's what's very important, to check your liver at least once in your lifetime. NAFLD is treatable, so fatty liver is treatable. We don't have any medication so far. There are many clinical trials testing new medications to decrease the risk of scarring in the liver as a result of the fat. But so far, nothing has shown efficacy. We're waiting for the FDA to review some new medications. They're very promising. What we do know is that if you follow a healthy diet, if you exercise regularly, if you decrease your body weight by 10%, that reduces the scarring in your liver. So yes, you can do something about fatty liver despite taking no medications. You can certainly help your liver by eating healthy and exercising regularly. Now let's touch base on a couple of myths related to liver disease and hepatitis. The first one, you cannot get hepatitis B or C through breastfeeding, sharing eating utensils, hugging, kissing, holding hands, coughing, or sneezing. You need to worry about that. You will not get hepatitis B or hepatitis C through any of these mechanisms. Is blood the main way that you can contract, you can get hepatitis B or C? Second fact, unlike other forms of hepatitis, specifically hepatitis A, hepatitis B or C are not spread through contaminated food or water. Contaminated food or water, you can be worried about different things, but you don't need to be worried about hepatitis B or C. So pizza is not going to give you hepatitis B or hepatitis C. The final one is, and it's also very important. So if I feel fine, I have no symptoms, I'm doing well, why should I get tested? The reason why you need to get tested at least once in your lifetime is because despite feeling fine, despite having no symptoms, you can still have hepatitis B and C. Again, I want to reiterate the example. Just a couple of weeks ago, I saw a patient, car accident in the 60s, got a blood transfusion back then. She was feeling perfectly fine for 40 plus years, and now she has cirrhosis due to hepatitis C and liver cancer. So that's not unlikely to happen if you get infected 40 years ago. So it's very important that if you find you can still have liver disease. There's another problem that I'm very concerned about is that, so in patients that have liver disease, there's this stigma that if you have liver disease, you have cirrhosis because you use alcohol, you're alcoholic, right? So people don't talk about that. So the two things. First, there are many reasons, there are many causes to have liver disease, not only alcohol. And second, even if you have alcoholic liver disease, you have an addiction, you have a disease, you need to be treated for that. You need to be stigmatized or judged or removed from society because you have a disease. It's called addiction. You need treatment, community, and help. That's it. So we need to start talking about this openly. We need to talk about liver disease. We talk about the different causes of liver disease because there's a way to treat them, and more importantly, there's a way to prevent them. So what can you do? Talk with your PCP, primary care physician. Tell him or tell her that you want to get tested for hepatitis B and hepatitis C. And if you have diabetes and obesity, that you would like to get tested for the potential presence of fatty liver. Blood test is very easy. A blood test, you can check it right away. Try to follow a healthy diet. What I mean by healthy diet, well, there are different approaches, but essentially it's common sense. So don't eat too much processed food. Don't drink too many sodas because they have a lot of sugar. Try to eat vegetables, fruits, some grains, eat fish, kind of a balanced diet. It's not a big secret. Everybody knows when you're eating something that you should not be eating. Exercise regularly. That's very important. It helps a lot the liver. It makes the fat from the liver mobilize. It makes it move to other parts of the body, consume the fat. So that's why it's so helpful to exercise regularly. Know your family history. Know if your parents have liver disease. Because if they have liver disease, you're at high risk of potentially developing liver disease. So that's very important that you understand your risk based on your family history of previous diseases. If you have hepatitis C or hepatitis B, you're diagnosed with that, you can call our team at Sinai, the lead team. We can help with linkage to our liver program here, with coordination, insurance, transportation, adherence to treatment. All of our patients were involved in this program. We have people that are dedicated, they're focused on helping, walk through the pathway of treatment for hepatitis B and hepatitis C. We speak English, Spanish, Korean, Bengali. You have here the email address and the phone number. You're gonna, join our program for the treatment of hepatitis B and hepatitis C. And with that, I'm done with the presentation. I don't know if there's any questions or any comments from the audience.
Thank you, Doctor. Don't have any comments, but wanted to say thank you for providing this information on viral hepatitis and also any other diseases that affect the liver. And I want to thank everybody for joining today. And again, thank you, Doctor, for taking your time to speak about hepatitis. And remember that hepatitis can be prevented, diagnosed, treated, and managed well. For more information, please visit on Sinai and visit or call us at Hispanic Federation. Thank you very much.